So our group had healthcare-associated infections, and we're going to talk a little bit about what these are specifically and how they're affecting the healthcare system, and then also what are things that healthcare workers and PTs in particular can do to prevent these and protect our patients. So first, a little bit of background on healthcare-associated infections. They're infections that occur in a multitude of different healthcare settings and happen when a patient is receiving care for something else, some other medical reason, whether it's like a surgery or they're in because they've been sick for something else, and then they pick this infection up. It's a major threat to patient safety and also creates significant financial consequences. Some of the major types of HAIs are central line associated bloodstream infections. So this is when a central line is inserted and the virus or bacteria gets into the bloodstream through the central line. There's a catheter associated urinary tract infection. This can happen in any part of the urinary system. One source said that 75% of hospital UTIs come from a catheter. So we talked a lot about this in acute care, where they're using more external catheters to try to prevent UTIs. Another type is the surgical site infection, so this can occur after surgery and it can be superficial or deep. And then our fourth type is ventilator-associated pneumonia, and it's an infection caused by use of a ventilator. So some categories of risk factors for patients to get these HAIs are things like medical procedures and antibiotic use, organizational factors, and patient characteristics. So patients like young children, the elderly, and people with compromised immune systems are at a higher risk. If a person has to stay in the hospital for a long time, they need an indwelling catheter, or failure of healthcare workers to wash their hands and an overuse of antibiotics can also increase a person's risk. One study found significantly higher rates in Asian and Hispanic patients than in white patients, and the difference was higher rates of the catheter-associated urinary tract infections. Other potential contributing factors include environmental or hospital factors such as open units, the beds being closer together, nurse-to-patient ratio, lack of procedures, or lack of sufficient equipment, and HAIs can have several different long-term effects. Obviously, there's going to be a negative effect on patients, such as prolonged hospital stays. It can create long-term disability and unfortunately also cause unnecessary death. 2 million suffer from HAIs in the US a year, with over 99,000 estimated deaths per year from HAIs. Also, with improper use of antibiotics, the bacteria can become resistant to antibiotics. So we need to make sure we're using antibiotics judiciously to slow the development of resistance and extend the life of the antibiotics that we're using right now. And then also there's a large cost to healthcare systems and patients, particularly with developing countries, just because they already have an economic burden. So how do we address healthcare-associated infections? They're common in acute care hospitals, long-term care facilities, and outpatient clinics, and as PTs, we will work in all of these settings. Some general strategies for management, not just for us, but also for others in the healthcare fields, would be things like frequent and thorough hand washing, so vigorous rubbing for 20 seconds, using soap and water, wearing appropriate PPE, and using correct donning and doffing techniques, using proper isolation precautions, enacting facility-wide sanitation and janitorial protocols, having written infection prevention policies, and regular facility-specific evidence-based infection prevention training, as well as having a designated staff member who is trained specifically in infection prevention and have them be on site to help manage infection prevention. Physical therapists also have a role in preventing healthcare-associated infections. So while we may not be directly impacting the infection as far as giving the patient antibiotics, we can practice in ways that reduce a patient's chance of getting an infection. So first, we can adhere to standard precautions as set out by our healthcare facilities, so things like proper hand washing, donning and doffing the correct PPE, handling contaminated objects safely, and then also practicing good respiratory and overall hygiene etiquette. We can also play an important role by preventing HAIs through education, so talking to our patients about signs and symptoms of infection and what to do if they do happen to think that they may have an infection. It's also important for physical therapists to be inspecting surgical incisions and wounds to make sure there aren't any infections occurring, and if we do happen to suspect one, getting them the help that they need. And then lastly, all physical therapists should ensure a safe and clean environment by wiping down all surfaces and objects used by patients and staff members. And this is just important to make sure that we're keeping our patients and ourselves safe and to reduce the risk of getting NHAI.